look into the future and we project increasing obesity rates in the city of Richmond based on our current childhood obesity rates, we're looking at over 11,000 adults with hypertension associated with obesity, over 3,000 with diabetes associated with obesity, and so on. Major impacts of obesity on the kinds of diseases that have major impacts. And it's not just illness. Obesity kills. We look at cardiovascular disease, 199 deaths per year on the average in the city of Richmond. Estimated 15% of those deaths are associated with obesity at our current prevalence rates. But in the future, as the obesity increases, we're looking at 23% of the cardiovascular deaths associated with obesity. Currently, about 11% of our deaths are associated with obesity, and we'll be projecting that to be approximately 18% of the deaths in the city of Richmond will be associated with obesity. Now, that doesn't mean more people's going to die. You know, it's one person, one life, one death. It all balances out in the end. But what it does mean is that people's lives will be shortened. From 2 to 7 years, people's lives will be shortened based on these kinds of prevalences of obesity. So let's look at the sugar-sweetened beverage consumption in Richmond. Our teenagers, aged 12 to 18, 67%, about two-thirds of them, consume one or more sweetened beverage per day. And why is sugar-sweetened beverages particularly important? One of the reasons is that the calories in sugar water are particularly insidious. When you drink a sugar-sweetened beverage, the physiologic action doesn't take place to make you satiated and give you messages that you've eaten enough now and you don't eat anymore. So on some warm summer afternoon, when you're consuming a double big gulp of a sugar-sweetened beverage, your body doesn't know that it has consumed about a half a pound of sugar and over 700 calories. You just don't feel that impact. And so you say, okay, let's have another pack of French fries. You don't have that kind of satiation. So sugar-sweetened beverages are very important in the epidemic of obesity. If we look at the average consumption of calories in sugar-sweetened beverages, they make you less hungry. Our youth, our teenagers who consume sugar-sweetened beverages on the average once a day, and that's two-thirds of our Richmond youth, consume more than 150,000 calories of sugar from sugar-sweetened beverages every year. That's like 275 Big Macs, extra Big Macs a year, but it's more insidious, because if you ate a Big Mac, you'd know you'd eaten something, and you might not go for the second pack of French fries, but the sugar and sugar-sweetened beverages is less prevalent. So we'll want to look at the sugar-sweetened beverage environment in Richmond. We've identified 583 sugar-sweetened beverage vendors, that is, retail grocers and others who sell sugar-sweetened beverages. This is from the Environmental Health Database. 3/4 of the population of Richmond live within a 5-minute walk of a sugar-sweetened beverage outlet. This is really available everywhere. There's an average of 5 sugar-sweetened beverage vendors within a 5-minute walk of our schools. Some schools have higher numbers, some less. But this is really a ubiquitous environment. I want to mention that because of this environment, it's very difficult to deal with the sugar-sweetened beverages. Now, every individual has the responsibility to make good choices for themselves and their children and their families. But we need an environment that supports people in making good choices. Those of us who are parents, who have been parents, and particularly nowadays, parents need all the help they can get in making good choices and having their children have good choices. We need to produce an environment that supports people in making healthy choices, that makes a healthy choice an easy choice. Sugar-sweetened beverage industry in the county, in the nation, excuse me, is really dominated by the big three. I didn't realize this: Coca-Cola, Pepsi-Cola, and Dr. Pepper. Snapple, you know, the Snapple lemonade, there's more sugar in that than there is in a Coke. account for about 2/3 of the sugar-sweetened beverage industry. The estimates of the economic costs of obesity been made over $400 million in Contra Costa County. This isn't broken down to Richmond. We didn't try to do that. Healthcare costs annually, these are estimates, over $270 million in lost productivity. This is because of illness associated with obesity. In the city of Richmond also, just point out soda and tooth decay, sugar-sweetened beverages and tooth decay, we know. Tooth decay is the leading health problem of children in Medi-Cal children in Contra Costa County in the city of Richmond. Our dental program goes into the Richmond schools and finds that 14 to 28% of the kids, and they screen all the kids in the elementary school, have visible tooth decay. You say, well, these are just baby teeth, they fall out, that's fine, you get new teeth, that's good, except kids with tooth decay and tooth pain don't do that well in school. So the epidemic of obesity didn't start with one cause, and it's not going to be ended with one solution. There's a whole variety of programs that have to combat childhood and adult obesity, evidence-based programs. Looking to the Richmond health and wellness element is a good place to find many of the kinds of activities and programs a city can do to improve the health of the community, particularly around obesity, improving parks and recreation, increasing access to fresh fruit and vegetables, building our communities so that bicycle and pedestrian paths are appropriate ways to travel, a whole host of programs that are available. But the point that we wanted to make is that the epidemic of obesity is nationwide. It's particularly strong here in West County. Everyone knows that you can look to the city of Richmond to find health problems. But people are learning now that you can look to the city of Richmond to find some of the leading health solutions. So thank you for allowing me to make this presentation.